You're live, Rick.
Okay. Thank you. Thank you, Brielle. Welcome, everyone. Please share this broadcast with your friends and colleagues. My name is Rick Ulfik, and I'm founder of We the World and the We campaign at we.net. There you can learn more about We the World and about 11 Days of Global Unity. Today is the fifth day of the 16th anniversary of 11 Days of Global Unity, September 11th to the 21st, which is the International Day of Peace. Back in 2004, We the World brought together global partners to launch 11 Days. This year, 11 Days is concurrent with the Up Convergence and Peace Weekend, an extraordinary alliance of organizations including Unity Earth, the Compassion Games, the Sign Network, We the World, Whole World View, and over 100 groups that represent an unprecedented unity movement, which of course is needed now more than ever before. To learn more and participate in 11 Days of Global Unity and the 11 campaigns for change that go all year long, you can go to 11daysofglobalunity.org. And that 11 is a numeral, 11daysofglobalunity.org. Each year, We the World hosts the 11 Days of Global Unity Telesummit with 11 powerful dialogues on each of the 11 campaigns for change. They are happening September 11th through the 21st, each day starting at 1 p.m. Eastern Time in the USA. Today, day 5 of 11 Days of Global Unity is on the theme of health. And I recommend getting your pen and paper ready to write down useful health information that you hear, because we have a remarkable group of people to talk about health. Catherine Davis, Paulette Spencer, Mark Haney, plus video clips from Dr. Ken Redcross, MD, Dr. Christine Horner, and Dr. Stephen Sinatra. Let's start with my co-host for this broadcast, Catherine Davis. Catherine, yes, I'm going to introduce you now.
Okay.
Catherine Davis has 29 years experience as a Qigong teacher, facilitator of meditation and energy healing systems. She is the host of Heart of Mind Radio for the new millennium, heard over WBAI Pacifica Radio 99.5 FM in New York and the Progressive Radio Network at prn.fm. And Catherine is coordinating the health campaign of We the World. Welcome to the broadcast, Catherine Davis.
Thank you so much. I'm really happy to be here. I've been so excited about this opportunity to be able to reach out to people and hopefully offer something that will be helpful to them, helpful for their lives and their families, but also an invitation to bring people not only into the We network, but also to have useful information to have a positive impact in your life, in your family, in your community. And so I'm happy to be able to announce joining us today is Paulette Spencer, MPHMA. Paulette is a community engagement policy analyst at the Bronx Community Health Network for the All of Us Research Program, which is part of the National Advancing Precision Medicine Initiative. Her specialties are global public health policy and international political economy. She holds graduate degrees from New York University and Fordham University. So welcome. So happy to have you joining us, Paulette.
Thank you for having me.
And so I've been really interested in your work because you have a quite a long career and a history of really working with communities, doing outreach to regular everyday people and helping them to improve their health or gain access to resources. So all of that being important. And now you're working very closely collaborating with the physicians and the researchers to discover how best to actually interact with and engage with the community in finding better ways to serve, I would say. So perhaps you can introduce yourself a bit in terms of your commitment to community work, and then talk a bit about the work that you're doing now.
Well, again, thank you very much for having me as part of this program. My interest in community stems from the fact that I'm actually from the community that I'm serving. So I'm here in the Bronx, and I grew up about 10 blocks from here in government housing. And I left for a period of time, but came back essentially to serve the community that I came from. And so here in the Bronx, I think how we've been perceived in the world for much of the last, I guess, few decades has this sort of stigma to it. It has a stigma of people being the sickest in New York City, the most violent. But when I came back, I realized that there's a way of uplifting that stigma, of demystifying it, fading it out. And I was fortunate enough to work as a program director for an agency called the Bronx Health Link, where I sort of had the freedom to decide how I wanted to approach the community and go and do special programming. In that case, it was for perinatal health. So we really focused on women in the community and their partners and how to make sure that they knew what they needed to know to have safe pregnancies and deliveries. So I also then left and started to do some work with the Einstein College of Medicine informally. I was invited to also be part of the Department of Family and Social Medicine at Montefiore as part of their strategic management team. And so I got sort of an invitation and sort of an initiation into the world of how doctors, physicians function in terms of the policies, the issues that they face in terms of keeping services going and trying to deliver the best possible quality services. Currently, I'm at the Bronx Community Health Network, and my position has been really focused on community engagement in different forms. It started out working to get people to come out to parks and to use parks more so that we could improve the community health in the surrounding neighborhoods. And currently I'm the community engagement lead, as you mentioned, for the All of Us research program, which is part of the Advancing Precision Medicine initiative that was started under the Obama administration. And the aim of that program is for us as a health center, which is what BCHN is, to get communities who have been traditionally underrepresented in medical studies as participants to join this national program, which features a database which they call the All of Us database. Now, my intentions are beyond just simply getting people to join a database. It's to bring the medical community together with the residents in a sort of non-traditional way. What I've been doing is sort of getting the physicians to come out of the clinics and to engage me and community residents through webinars, where we talk about individual themes that affect the Bronx community. We've had physicians who specialize in primary care talking about what research actually takes place at hospitals that are teaching hospitals through the screening process, and how hospitals actually improve their services by gathering that data from the community. We also have spoken with rheumatologists who spoke at length about the importance of understanding lupus. But the overarching intention is to look at ailments or conditions that affect Bronx communities the most, and to make the case for their participating in medical studies that address these particular ailments. And as part of that, we of course have to look at the issue of the legacy of mistreatment or maltreatment towards communities of color when it comes to experimentation or studies. And we talk at length about that and the importance of what we call informed consent. And so we've had those conversations. I've been fortunate enough to bring on many of the physicians who I've met through my work at the medical school. And they've been very receptive to come out and have these discussions. They're more than just the 15 minutes you get with your doctor when you're sitting next to them in their office. It's an entire hour-long discussion. And we include the community residents. So our residents have the opportunity to ask questions, to make comments. And the aim really at the end of the day is to make sure it's an educational experience, regardless of whether or not a person decides to sign up for this All of Us database or not.
Amazing. That sounds wonderful. And how have you found that the doctors have grown through their engagement with the community?
I've seen that they've been rather, I think, almost eager to be part of this. I have gotten the impression that they were like waiting or for someone to invite them to come out of their offices and sort of have this forum where they could engage with the community, sort of unencumbered by let's say institutional norms where they can only be with the patient within their office for 15 minutes. And so it's been very positive. And when we had our launch a year ago, a whole group of physicians said to me that they were looking forward to this. And so, yeah, hopefully we can improve the communication between residents and medical personnel. And we can have some frank discussions about perceptions, about trust, and then move forward. I think dialogue is important, and this is a first step to something that I hope develops into something that bigger than all of us.
Most certainly, we hope that it has, if it hasn't already, expanded to a greater swath of communities. But I find it really special that it does happen in the Bronx, because as you said, the Bronx is sort of the worst case scenario in many ways, and having very high levels of problems and issues with regard to health and low connection to the services that they need. A little bit later on, we're going to be hearing from Mark Hannay, and he talks about this as well, how the boroughs have already been so pared down because of funding and not having beds and all that stuff, that you have the most vulnerable people with the least access to services. So I think that the work that you're doing is really, really important. I'm going to play a video montage featuring a couple of doctors. And the first one, Dr. Ken Redcross, is a MD and author of Bond, The Cornerstone of a Lasting and Caring Relationship with Your Doctor. And he talks about this relationship that you were talking about, that this is actually necessary for healing. Also, Dr. Christine Horner, one of the country's leading authorities in preventive health, and she's really a plastic surgeon and was very key to making sure that women who needed reconstructive surgery would have that paid for, and nobody would be denied that. And also we're going to hear from Dr. Steven Sinatra, a cardiologist with an integrative approach to cardiovascular disease. Now, what we're talking about, however, is the most current issue of our day, and that's COVID-19. And I find it very interesting what they have to share. These are shorter clips, and we'll make the longer clips available to people. But this is a way for us to really make that connection to health in a way that we can empower ourselves. And that's why I wanted to include these doctors. So I'm going to share this screen and give you an opportunity to have a listen.
Thank you so much for having me on today. To have a forum and a discussion about something that affects us so much, even more so than things have in the past. Because what COVID really has done is just really shown a light on something that we've all known about as far as healthcare disparities now. So now it matters, and we have to make it count. Now, I wrote that book a couple of years ago without knowing what kind of impact it was going to have as far as it being perfect now. I talked about the 4 cornerstones, meaning trust, respect, empathy, and communication for that relationship to be the way it needs to be. And it's even more important now with COVID-19 circulating, especially in our community, that those 4 things are actually mended and blended in order for us to find the right providers for us. But it's challenging. It's very difficult, as you know, because you're right. We tend to get a lot of our care at the emergency room instead of with a doctor who knows you. As I like to say, my preference actually, Catherine, is to get into the soul of the patient. And you can't do that when you're going to the emergency room each and every time. There's not any one of us who aren't familiar with the Tuskegee experiment. There's even other experiments that go way back even before the Tuskegee experiment. When you're right, this has been so deep-seated, almost over generations now, right? And now we have to try to unleash ourselves from that to say, you know what? Our health matters as well. How are we going to take better care of ourselves? What is the message or the messenger to make sure that we're taking care of our health? That's so key. The messenger is incredibly important, especially within our community. It's not much different than that, even in the Latino community, where once again, the messenger is incredibly important to make sure that the incentives are driven down to say that I actually care as well, and I'm here to help you. So everyone, when you hear about the coronavirus, COVID-19, we call it COVID-19. It was at the end of 2019. That's where the 19 part comes in. Now, coronavirus isn't necessarily new to us. That's one of the common cold viruses we get. Corona, rhino, echo, all these viruses are common. The problem with this one is that it's novel. It's a strain that we haven't seen before because it's been mixed, and we all know it came and it kind of swept over here. Now, the whole challenge with the coronavirus is that we're learning more and more about it. I mean, each and every day I update myself, and I swear, everybody, there's something new as we're learning. We're learning that, look, it just makes sense. I don't care what side of the aisle you're on, Catherine, but it just makes sense to wear a mask. It's a respiratory illness, everybody. So therefore, like I say, you can fight another day, this aisle or that aisle, live first and then fight later because it's a respiratory virus. And so there's been more data that it's important to maybe even cover your eyes because that's another portal for entry. But the point is, everyone, the coronavirus is a virus that our body hasn't seen, and it's become a pandemic, meaning that obviously it's affected the whole entire world. We did a good job at the beginning because we needed to stay in to make sure that virus didn't propagate. But then we got a little antsy. I think we started to look more at a financial piece as opposed to a public health piece to be just, a little tougher. But I get it. A lot of people had to go back to work. So look, this isn't an easy answer, but it does take leadership, and it takes a bunch of unity to fight a pandemic. This is a public health problem, not a political one. And so that's why I say we all have to come together to figure out how we're going to attack this pandemic, because remember the last pandemic, it was almost 100 years ago. And so they had to deal with it. They even had another wave of that. But once again, you look back at those black and whites and those photos, and those folks were wearing masks in order to get rid of it. So this is the new normal that we're living in, and we're going to have to figure out what are we going to do next, especially as flu season is only around the corner as well. So let me do this. Let me go back a little bit, everyone. We'll do Immunology 101. So we have two sort of ways that we fight infection. So an infection comes in our body. There's an innate immune system, guys. That's the thing that happens within minutes when we start to say, I feel like I'm coming down with something. Our body is already sending out phagocytes and other things that actually engulf them. A little bit later on, days to weeks, what happens then is what's called an acquired immunity. That's when our cells get a little smarter and say, I think I'm ready for this. Have I seen it before? No, I haven't. So I'm going to start making antibodies to start trying to fight it. Those are the things that we're later starting to measure to see if that helps. So that's how our immunology works. Now, one of the problems is that we have some chemicals in our bodies. They're messenger chemicals. They tell the other immune cells, hey, we're fighting an infection down here. We need some reinforcements. They're called cytokines. The problem with COVID is that it can cause that system to go haywire. It can cause the system to go haywire. And when it goes haywire like that, you get a ton of inflammation, which our body does not want, because with inflammation becomes irritation of the blood vessels, clotting, that sort of thing. From the clotting, you get end organ damage, the kidneys, the liver, appendages, your fingers, your toes, some of those things. So it's that cytokine storm that is so deadly that really comes along with the coronavirus, with the way that it works in particular. Look, I've seen even other studies. They're talking about, obviously you've heard a lot about the taste and the smell that people talk about. You'll even find people who have recovered from the coronavirus, but their cognition isn't what it used to be. So this is a very unique and dangerous virus that we continue to learn about. So that's why it's important to get some education around it and to do our best to avoid getting it, and then to recognize, what are we going to do, especially with our loved ones, to educate them to make sure that we're all in this fight together. Question that patients ask. They know that there's certain things that are good for immune health. So let me tell you this. Now, we don't have a direct treatment for the coronavirus. So that's so important, because today one of the bigger things we need to discuss as a community is vitamin D. Now, vitamin D, I'll say it till I'm blue in the face. It doesn't treat the coronavirus. That's not what we're talking about. We just understand that vitamin D is incredibly important for our immune system. Remember, I told you that Immunology 101, there was one arm here, one arm there. Well, guess what? Vitamin D is important because almost every one of our immune cells have a receptor for vitamin D on them. We also have some studies that showed that acute respiratory infections may be a little bit higher in those who have profoundly decreased vitamin D levels. What's even more important is that you look at it, who has the lowest vitamin D levels in the United States? African Americans, about 82% of us, okay? And then behind that are Hispanic brothers and sisters, usually around 70 or so. So they're low as well. Why are we low? Vitamin D is not really that high in our diet. You have to eat fatty fish. I'm a sardine fan, so I can get a good amount out of sardines, but it's not much in your diet naturally. And then the sun is blocked by our melanin in the rays, and a lot of us are not working outside. So there's a lot of reasons behind that, but a lot of the diseases that were associated with the coronavirus that preyed upon us, in particular, lung disease, heart disease, diabetes, obesity, all of those can have states where vitamin D can be low and really play a part in your health, especially obesity, as we're learning about. So that's why I say I bring in vitamin D, because I want a challenge. I want to challenge everybody out there listening or watching this video to say, I want you to get on my level. That's the campaign I have. And my level, I'm talking about between 40 and 60 of our vitamin D level. I want it to be so that in the family, we're trying to challenge each other, because that's the sweet spot. They have a website. It's called powerofd.org. I mentioned that website there, Catherine, because that allows me one more kind of helper. because I tell people to go to your doctor to get your vitamin D levels checked. But we talked about at the top of the show, that's difficult for some people. At their powerofd.org, they actually have an at-home test kit that you can order. It's a finger stick. A lot of us are familiar with that. If diabetics, you're checking your finger stick. So it's a quick finger stick. You send it in. You get your results in about a week or so. They also have a calculator on the powerofd.org website where you can calculate how much vitamin D you should be taking, and a lot of information that we need to really take in.
Well, I think we have to be super conscientious. I mean, obviously, the virus is something that's extremely dangerous. And I know both of us have lost, people that are close to us, and it's still spreading, like crazy. And so we really do need to take it seriously and really kind of follow all the recommendations that are given to us as far as the, using a face mask. And I'm a grandmother, at this point too. And it's like, well, and I live alone, so it's like, well, I had to, after a couple months of quarantining myself, I felt insane. And it was like, okay, I've got to figure out a way where I can actually see a few friends and just call them my family members, right? Because I don't have anybody else with me. And then I'm actually seeing somebody. We hug each other because, I had nobody touching me or anything for, months. And then all the things that I personally did that, brought me joy and were stress relieving things like playing tennis and doing ballroom dancing and, going to the gym. All those things are gone. So it's like, wow, we are so slugged with so many difficulties on so many different layers that it's like, okay, you really need to figure out what works for you. And again, we kind of have to limit ourselves. We can't do family gatherings of, 30 people or something like that. We found that doesn't work. You have to keep the group smaller and, do the social distancing and that kind of thing. But, really figuring out something that works for you so that you can enjoy decent mental and physical health. That's the key things. And then the other thing is just really being conscientious about all the different things that you need to do to support a healthy immune system, because people who have healthy immune systems can really avoid, getting sick in the first place, or if they do, then it minimizes the symptoms that they have and the potential for bad outcomes.
What should we be doing during this time? Because as long as we're being careful and safe, we can take that time to really work on building our immune system. So what strategy would you suggest for people to do that?
Sure. So having a healthy immune system really takes what I call a holistic approach. So it's not like there's just one thing, but it turns out that very much your diet and many different factors in your lifestyle, and then several different kind of nutritional supplements that can be helpful. But there's, a number of things. And I wrote a book that came out recently called Radiant Health, Ageless Beauty. And it's a guide for teaching people how to achieve extraordinary health and longevity, which is something I never learned in medical school or in my residency. You learn about diseases and what you can do to help to suppress the symptoms or cut things out, when you're a surgeon. But I didn't really learn about health. And that's something that I learned, much later, kind of on my own about, how do you actually, create health? So and like I said, it turns out it's not just one thing. There's many different things that are of equal importance. So first of all, our diet, as everyone knows, is crucially important. And what the research shows is that eating primarily a plant-based diet is considered the healthiest kind of food that you can eat. They're packed full of nutrients and vitamins and minerals and different kinds of plant chemicals called phytochemicals, which act like natural medicines. So the more plants we eat, the better it is. We want to avoid all the things that people usually immediately jump into wanting to eat, like as comfort foods, right? Usually those things are real bad for us, and particularly things that are, refined carbohydrates and sugar and, the empty calorie things. Those things really, kind of kill off our immune system and, cause our body to not function very well at all. So you have to really avoid that impulse, to reach for those comfort foods. And then as far as lifestyle is concerned, exercising every day is important. And of course, we're challenged by that with the quarantines and so forth. And, in my life, I was super, super active and, going to the gym, they closed our gyms down. So it's like, well, what do you do? Well, fortunately, I'm a runner, so, I can go out and run every day, but, definitely walking, like the research will show that if you do 30 minutes of brisk walking a day, that gives you almost the maximum health benefits that you can get from exercise. So it doesn't require that much, but, that's a good thing to do, just to move your body. I actually have my sister-in-law come over and do yoga with me with YouTube videos, so that's a great thing with YouTube. There's so many instructional videos on there and you can do classes, for free, in your house. So, again, figuring out something that really, works for you. And it's great to do something that's aerobic, and also doing some strengthening, kinds of exercises, which, yoga can do that because you're, supporting, your body weight. Going to bed by 10 o'clock turns out to be incredibly important. So it turns out the number of hours that we sleep a night is important. And usually you're recommended to sleep about 7 to 8 hours a night. But then the absolute times that you go to bed and sleep are equally important. So we have hormonal fluctuations that happen throughout the day and throughout the night. If you go to bed by 10 o'clock and get up before 6 o'clock, those hormonal fluctuations are optimal. If you stay up after 10 o'clock, then they're not. And they find that if people stay up to midnight, for instance, on a regular basis, that they have twice the incidence of heart disease, diabetes, obesity, and certain cancers like breast cancer and prostate cancer, because it causes such severe hormonal imbalances. And it's not just with like estrogen, progesterone, those kinds of things. It's also insulin, which is the hormone that helps to facilitate getting glucose into our cells. It's the stress hormones, cortisol. It's our sleep hormone, melatonin. So all of those things kind of interact. And again, just going to bed before 10 o'clock, which is a super easy, inexpensive thing to do, then that really, balances your body and lowers your risks, of those various different diseases, and helps to keep your immune system strong.
One of the things, Catherine, about this virus is that in my history of being a doctor, which is around 50 years, and I sort of treated, I would say, thousands of patients over decades in the ICU, CCU, emergency room, all these, acute intensive care units. And we've seen a lot of viruses. I mean, I've seen multiple viruses in my lifetime, but I'd never seen one as tenacious and as invasive as this one. Because not only does it attack the lung, it gets inside the lung, but it attacks the brain, the GI tract, the heart, the skin. So it's a multisystemic virus. It's a very, very tenacious virus, and it causes, severe breakdown. And the other thing that bothers me about this virus is that even though when you get through the acute episode, you may have a problem a few weeks down the line or a few months down the line where now you get secondary organ involvement as a result of the invasive nature of the virus when it attacked not only the lung, but this virus sort of has a vascular affiliation. It gets inside what we call the endothelial cells or the vascular endothelium. So that's why it's so pervasive in the body. In other words, it's not just the heart and lungs, it's everywhere in the body, including the brain. Hemorrhages in the brain right now are a factor with this virus as well. So I'm very, very concerned about it. And in my lifetime, I don't think I've ever seen anything as horrible as this one. I'll be honest,
Well, I'm glad you're being honest, because one of the frustrations that I have been experiencing are people claiming that it's not real, people claiming, that it's the regular flu. And I think it's really important that people understand that while there are different levels of impact depending on a person's state of health, that this is really something that's happening to people, and there are dire consequences for many who become infected. So I really appreciate your sharing that, because I feel that people are not taking it seriously enough and then putting themselves in danger when they might not need to.
Correct.
So I think it's really important.
I totally agree. I mean, with this virus, trust me, an ounce of prevention is worth a pound of cure. You know what I mean? So you really want to prevent getting it. And I think that's the key going forward.
So let's go into that prevention, what we can do. Is there a way that we can know how to preserve our heart or to recognize if we are vulnerable because of our hearts?
The way I would answer that is there's a number of comorbidities. In other words, these are people who are more at risk with the virus. So certainly anybody with any form of cardiovascular disease would be at risk. And that would be, the worst risk would be sort of an aging person in their 7th, 8th, or 9th decade of life with a history of congestive heart failure or a history of heart attack. Then going down the scale, it could be somebody in that age group with just high blood pressure. High blood pressure puts a strain on the heart as well. And there's an entity we call diastolic dysfunction of the heart, which results in the heart needing more energy to fill the heart with blood as opposed to emptying the heart. And with people with high blood pressure, they tend to get that more and more. And when you have a virus attacking the lung in the presence of high blood pressure, this puts a big strain on the heart. And that's why these people do worse. And it's important for us to realize that if we can reduce our risk factors going forward, and let me elaborate on that. For example, if you are a hypertensive person, then it behooves you to get your blood pressure down. Now, that could include taking in a lot less salt in your meals, for example. That could include a mere 5 or 10 pound weight loss. I've seen this happen over and over again, where if we can take away a few pounds of weight, our blood pressure drops. And while I'm speaking about a mere few pounds of weight loss, the other major comorbidity in this virus is diabetes. And right now in America, Catherine, there's about 100 million diabetics. This is an epidemic that is going on and on and on for years. And because we're sort of a carbohydrate sugar society, and people are getting a little heavier, and diabetes is something that is a major comorbidity, not only because there's more fat cells in the body with a type 2 diabetic, and remember, the fat cells, they are the home for these inflammatory cytokines. In other words, these inflammatory messages in the body, they live in fat cells. So if there's a lot more fat on a person, there's more inflammation. That's why obesity was a major risk factor in this virus. A lot of people who were grossly overweight suffered more and had more deadly outcomes than people of normal weight. Again, because the amount of inflammation in the body would skyrocket. So I think for me as a heart specialist, I think what the public needs to glean from this is that if we can eat a less carbohydrate diet, in other words, eating less sugar, if we can maybe drop 5 to 10 pounds, which we all could anyway, if we could do a little more exercise and a little more walking, for example, or cycling, if people could just do simple things in their life, just simple things, getting more sunshine. I'll tell you, Catherine, I think sunshine is awesome in this virus because vitamin D has so many great characteristics in fending off the virus. And vitamin D has so many anti-inflammatory properties that I believe simple maneuvers, and again, less sugar, more exercise, taking in a little more vitamin D. Now you can get that through sunlight or you can get it through supplementation. But I just feel if we can manage the blood pressure, manage the weight, manage our stress, more proteins in a diet, more healthy fats in a diet, less carbohydrates, less sugars. And while I'm on that, I should mention this. When people take in a lot of carbohydrates or sugar, we know, for example, that when the sugar rises in the bloodstream, and this is why a lot of diabetics get infections, sugar stifles what we call the phagocytic activity of white blood cells. In other words, it makes blood cells less effective in eradicating pathogens like bacteria and viruses. So it behooves, us to take in less sugary foods. So, from my point of view, it's the easy things that I think we got to focus on.
Yeah, I can see that. And I think that that's something that a lot of people can do.
Very informative.
What I took away from these interviews was very powerful because, as one of the doctors mentioned, I've lost people very close to me in my family, and I have friends who have lost parents. And it's taken a long while to get a handle on this virus, but it seems that the true way to get beyond it is to just be as healthy as we can. That really is the best advice I'm getting, to take the nutrients, make ourselves healthy, and then we become less vulnerable. We become the people who don't have the comorbidities. We have to work towards that in the interim so that we can reclaim our vitality. So there are a lot of takeaways to these interviews, including dealing with stress is a big factor as well.
Sure. And I found myself, as the doctors were talking, I was doing my own checklist in my own mind, am I getting to sleep at 10 p.m.? No. I mean, I haven't gone to sleep at 10 p.m. in years.
Yeah, that's the one I kind of missed too. I didn't realize sleep played such a big role. I mean, if all we had to do is go to sleep at 10 p.m. to live, it might be worth it to do that.
Yeah, I know. And I know. Well, I've heard that sleep deprivation is immune suppressive, definitely. Mm-hmm. But it's interesting that I think it was Dr. Christine Horner was saying that the actual time that you go to sleep is also important, mm-hmm. Not just the number of hours. So I hadn't heard that before.
Yeah, to keep the hormones in balance. Mm-hmm. So that's pretty cool. So I guess I could bring up the next segment, and we're going to be hearing from Mark Haney. And Mark Haney is director of Metro New York Healthcare for All, a citywide coalition of community groups and labor unions. He is a member of the leadership bodies of Healthcare for All New York, the New York State Network of Healthcare for America Now, the National Universal Healthcare Action Network. And he has a long career as an activist. He began his career in 1991 as a member of the Insurance and Healthcare Access Committee of ACT UP New York. And during the Clinton health reform period between 1993 and 94, he worked as a public policy associate at Gay Men's Health Crisis. He's won lots of awards. And so we're going to go to his talk, because he talks about really his work as an activist and how important it is to engage in making these changes in the world. He did send me a note to share with people. For those who don't have any health care plan in place or who are uninsured, you can enroll in the city's NYC Care program that provides low or no cost health care via the city's public hospital system. And you can call 646 NYC Care, C-A-R-E. That's 646 NYC-CARE. And you could go to the website newyorkcare.nyc. So I'm going to go to his presentation, and then we'll be back after that. Yeah. So I think it would be great if you could talk to us about what you've been doing in the last couple of years, really in your work that as an advocate for public health. What kind of engagements have you been involved in over the last couple of years where you've seen some movement or maybe some frustrations?
Both. Well, I would say we began a new period of activism in the healthcare justice movement in 2017 when the Trump administration came into office, and their immediate attack on the Affordable Care Act and the programs that had come into being under the Obama administration and so forth, which was itself the culmination of about a 20-year campaign to get some national legislation through. Started with the Clinton effort, which didn't succeed as envisioned. Some good stuff came out of that in smaller pieces, but then under Obama, we had the major piece of legislation came in, and then Trump and his congressional allies immediately began to attack that legacy, as you will. So we had a whole defensive campaign around that that is still going on to some degree, both their attack and our defense. So I think this year, what I tell people in my sort of nonpartisan hat is that healthcare, it continues to be a top voter concern this coming election cycle. And the future of healthcare in the United States is very much on the ballot this fall. So it's really important that people understand those issues, what's at stake in this year's elections, and get out and vote this fall, because healthcare in this year's election cycle is part of a much larger constellation of social justice issues across the board. And it's really important that people turn out and vote this fall to make sure that the future of our country on healthcare and a lot of social justice issues goes in the correct direction, as opposed to one that will be very destructive. So that's sort of one thing in general. And then, of course, with the advent of the pandemic within the last 6 months, public health concerns in general have risen to the fore. And the pandemic has exposed all the fissures across our society around healthcare and a whole lot of other social justice issues that have been there for a long, long time. And they've just really been laid bare by both the pandemic itself and the ramifications of the pandemic. And so trying to respond in that way has also been a major focus of healthcare justice folks across the country and here in New York.
Yeah, and it does seem like progress is not being made from my perspective, from my vantage point. Now, I don't know if that's true, but there are two things that I have found myself really concerned about, and maybe you can look at that, is that especially in the very beginning of the pandemic, the treatments that were being done were in many ways too excessive. And people who needed help early on couldn't get help early on because there just wasn't that access to be able to get treatment before they reach that critical state to get into the hospital. And then also I have some concern about how long it took for the system to realize that we really need to go back to treating each individual, because there are differences between how people present.
Yes.
And the kind of care that they need, and even the kind of self-care that they need to do at home. I don't feel that the system was equipped to really handle all that. And I'm wondering if there's a way to start advocating for that kind of service to really assist people. It wouldn't cost a lot of money to be able to tell people to go home and take vitamin C, if that's what the advice would be.
Right. I mean, to be fair, everybody was responding to something that was overwhelming and unfamiliar. And, the phrase that's often used is, in terms of the response to when the pandemic first arrived, was, we were building the plane while we were flying it. So, everybody was trying to do the best they could. I think we have a much better handle on that now, both medically, in terms of public health, and in a number of ways than we did 6 months ago. That said, we are far from out of the woods on any of this stuff yet. And yeah, in terms of personal health and preventive measures that people can take, I think it's not something that I track all that closely, but my sense is that we're still on a learning curve on that, and trying to figure that out. Obviously, just general ways that people have known for a long time about how to keep yourself healthier, and protect yourself from any kind of infectious and contagious disease, not just this one. Right, getting enough sleep, etc. As well as the importance of, particularly in this kind of very contagious virus, protecting yourselves, the importance of social isolation to some degree, social distancing, the widespread use of masks. It'll be interesting while we go into the normal flu season now to see if everyone really adheres to all those measures. We may see much less prevalence of a general flu out and about because, we're staying home, we're wearing masks, we're keeping our distance, all that kind of stuff.
Yeah. I totally agree with you there. I think what I was also reaching for is one of the advice that they gave to people was to stay home, don't come to the hospital till you can't wait any longer. Mm-hmm. And that's really what I was looking at in terms of advocating for policy so that people would understand that it's in those early stages of the virus where help can be offered and that help be more valuable.
Sure.
So that's what I was looking to find advocacy for, so that people are not sent home from the hospital 3 times before they come back the 4th time in an absolute crisis. And I saw that changed a bit in New York, but then I saw the same process repeat again in Florida and in Texas, where they held back until the system was overwhelmed, and then scores of people who could have been helped were not because the hospitals were overwhelmed. That's kind of what I'm referring to.
Yeah, I mean, we were among the first regions to really experience it, and we learned from it. And I think, sad to say to some extent, that until you actually live through that kind of a situation, you don't really grasp what's needed and what you need to do and what's behind it. But I would say in general, people should be in regular touch with their primary care providers. And if you don't currently have a primary care provider, it's important to find one. So talk to your health plan and other folks to see, who's in their network and et cetera. Get an ongoing relationship established there. Yeah, we were overwhelmed here in New York, and one of the inequities that was really revealed by the first wave that hit here in New York City was the disparity across the city in terms of access to hospital care when you were in acute crisis and needed it. The borough that was first hit the hardest, Queens, has the lowest per person bed capacity of any of the boroughs in New York City, and has about 1.5 beds per 1,000 residents.
Whoa.
Whereas we see a well-resourced borough like Manhattan had 6.5 beds per 1,000, which was quite a disparity. The next borough that was hit the hardest was the Bronx. It has about 2.4 beds per 1,000 people. So again, we see this huge disparity in New York City. And so, and this is a result of, 2 decades worth of steps that have been taken by local and state government that perhaps wittingly or unwittingly have resulted in this situation where there's this disparity. So the very people who needed the hospital resources the most were living in the areas where there were the least amount of hospital resources available. And even when you look at the system overall, where those folks tended to go and turn to for care was our public hospital system, which is the most culturally and linguistically competent of all the systems across our city, because they have a long history and tradition of that. And so they were overwhelmed, particularly Elmhurst Hospital in Queens, which became very sort of, got a lot of media attention at the beginning, well-deserved because of the crisis that they were trying to manage. Mm-hmm. And also, again, when we look at the public system versus the private voluntary system here in the city, the public system historically has been under-resourced compared to the other systems, which are often based in very well-resourced academic medical centers. And that's not to put them down or anything. It's just to say there's this disparity here that we need to address. And so there are a bunch of health advocates that are now coming together to call attention to those kinds of disparities, as well as to look at the whole issue of health equity and health disparities that has been completely laid bare by this pandemic, both across the country as well as here in New York.
Yeah, you know, I think that that's really important. I think that a lot of people are coming to the conclusion or being convinced that there isn't a real problem because they're looking in their neighborhoods and their communities and everybody looks fine. So could you sort of suss out some of these disparities for people, because we're going to be reaching a broad audience of people who might be challenged in that way, so that we can understand how we need to direct our energies to change those disparities.
Well, in general, even before this pandemic arrived, you know, there were significant health disparities based on race and ethnicity, age, gender, your zip code, a whole lot of things that you could look at. And this pandemic sort of ripped the veil off of all of that. And so it's there. And so we need to really address it. And that the state government plays a lead role in that situation, both in terms of how it evolved to the point that it got to and is now, and in terms of addressing it and fixing it. We really need to turn to state government, because they have the responsibility for sort of organizing the healthcare system. Local city government and county governments can play a role in that too, by especially calling attention to state officials that, hey, something's not right in this picture and we gotta address it and fix it. And, you know, we're willing to work here and be your partners in this, but you guys have, you know, gotta take the lead on it. In terms of sort of broader public health stuff, that is often operationalized at a very local level, here in the city, and at county levels and so forth in New York State, again, in partnership with the state, in terms of that. In fact, modern public health as we know it was, you know, 100 plus years ago, grew up in New York City. And in response to the waves of immigration that had come into New York City in the late 19th and early 20th century. And so we have a long, proud tradition here in New York of leading the way, and the City Department of Health and so forth really stepped up again as best it could, given the crisis that it was confronted, and has moved along. We have seems to be having a good testing and tracing program that's up and running now. There were some bumps along the road, of course, but it seems to be working. The rates seem to be staying pretty low, and so that's good news. You know, so I think those are some things that we can do on a personal level, of course, until we have a vaccine available, and not just available, but that it's administered to people widely and has had a chance to sort of settle in, if you will, you know, which is going to be several months down the road at least. You know, we still have to maintain these social mitigation strategies to kind of keep the spread at bay. So that's like no large crowds in indoor spaces, continuing to wear a mask, keep your social distance, staying at home as much as you can, and so forth, etc. On the medical side of things, they really have gotten a better handle on how to treat people who develop acute COVID-19 illness, to better treat them. So the mortality rate has dropped significantly. So that's good. I think we are still going to be watching for, for people who have experienced COVID-19 illness. What are the, and recovered and are, back more or less functional. What are the longer term personal health implications of that? We don't know that. That will come to the fore over time, anecdotally from people I've known who've experienced it. They often report they still are, tired by the end of the day, and they don't quite feel themselves yet, although they're, getting better day by day, week by week, month by month. But,
yeah, that's what I'm beginning to hear. There's this long hauler thing where people are actually having their immune systems impacted in ways that were not understood in the beginning. And I believe that that's going to take a whole nother wave of studies and to figure out how to help people like this. And information is starting to come out. One of the things that's been consistent that I've heard speaking to doctors is that vitamin D plays a big role. People who have low vitamin D tend to have worse symptoms than people who have the appropriate amount in their systems. So there are things that they are beginning to learn that we can look to and think about as we move forward with it. But you did bring up something really interesting for me when you were talking about the state government. Because for me, the whole push towards healthcare has been Medicare for all, universal healthcare. And it looks to me like there's going to be a stall with that, or at least an ongoing fight. But the idea of beginning to advocate for whatever money is there now, how do we want it to be spent? So if we want to push to make sure that hospitals in compromised or poor communities are staffed and have the beds, I mean, to me, that's something powerful to advocate for, until we get to the point of having health care for all. And I was wondering if you had any other insights about what we could be looking at.
Well, I think one of the other things that has absolutely been laid bare by this pandemic is the absolute imperative. We must put some universal healthcare program in place. In this country, in this state, whatever. There are various proposals out there to do that. Some are better than others. Some are incomplete. Most healthcare justice advocates are pushing for this Medicare for all kind of approach that's really sort of a national healthcare program like every other advanced democracy has. We're the only ones that don't have some kind of program like that, and we need to get to that because we're not going to get through this whole pandemic or any future pandemics that might come along if we continue to have a bunch of people off to the side who don't have access to health care. That puts all of us at risk. And so we absolutely must have some kind of universal health care program. Now that's going to take some money, particularly up front, because, the Medicare for all advocates, and I'm one of them, correctly claim that once you get this system in place, you're going to have a lot of savings that you're going to generate through the system because you get rid of a lot of inefficiencies and the profit motive and all that sort of stuff. You sort of remove it. But, getting a system like that kind of fully up and running is going to take some investment. And so there is a need to, make sure that the funds are going to be available to do that. If we're going to do that here in New York, and there is a bill, the New York Health Act, which has been gaining steam for several years now in the legislature. And given how the next legislature starting in January looks like it's going to shape up, there will be more progressives than ever in both the Assembly and the Senate. So we're going to have a real opportunity to move that bill forward at a state level, but that's going to take some money. And the state budget is not in good shape right now because of the economic recession that has resulted from the pandemic. And there's been a whole movement building broadly across issues, not just healthcare, public education, housing. A lot of different advocates have been working together to say to our state government leaders, we need to create some new forms of revenue so there's more money in the pot, not just to address the the current deficits that have arisen in the last 6 months because of the pandemic, but also for years, many programs have been underfunded, and particularly now in the wake of the pandemic, need to be better funded than ever. And the governor, unfortunately, has been very resistant. The proposals that have been developed by advocates have been all oriented toward slightly raising taxes a bit on the very ultra wealthy. And we've come up with a number of ways to do that, which would generate all the money we would need and more. And the governor, unfortunately, has been very resistant. He's been falsely claiming that the rich are going to leave if we tax them a bit more. And although all the research shows that that is not the case, a few anecdotally will leave. But the amount of money that you will generate overall under these new taxes will be offset by, whoever leaves. And so we need to pursue that agenda, not just moving forward on healthcare and a bunch of other issues, but we need to rebalance the economic structure in our state. And also this is true nationally. We don't exist in a bubble here in New York. So that, again, depending on how these elections turn out, whoever the next president is, whatever the next balance of power is in the Congress, we may have some opportunities to really address the underlying economic inequalities that have been worsening for 2, 3, 4 decades now.
Mm-hmm. That's right. And you have been an advocate through those decades, I believe. And can you speak to how you're impacted personally in terms of how do you maintain your interest, the power within your work, and the desire to keep going? I've spoken to a lot of activists recently who are despairing over the state of politics. And I want to be able to encourage people to keep moving and to keep working on all this.
Yeah, it is challenging, both particularly in the last 6 months. It's been overwhelming. It's sort of like you're being hit by water out of a fire hose, and you're trying to respond to this. So that's a challenge, and the political landscape is to address these things is not ideal. Hopefully, that will improve after these fall's elections. Mm-hmm. I don't want to sell anybody on a panacea. No matter who wins, even under the best of circumstances, how the election might fall out, we still have a lot of work in front of us. So we just have to be aware of this and look at this as like, we're in this for the long haul, and it's going to be a long haul, and pace ourselves a bit. Sort of like looking at less like a sprint and more like a marathon. And to be strategic in our thinking, even under the best of circumstances, the impulse is going to justifiably be to try to go for as much as we can get. And, we need to be putting those broad goals out there. But again, understanding that we're going to have to be strategic about how we go for all of that stuff, because we're not going to be able to get everything we want in the first 90 days of possibly, say, a Biden administration with Democrats in control of both houses of Congress. I mean, it's just not going to happen. So,
well, we've had that in the past, and not so much happened. So I think we have to rely upon ourselves. Yeah.
But to get to your question of, sort of how do you keep going under this, I think is to kind of keep that in mind. This is a longer haul. We do talk amongst ourselves as activists about how to keep ourselves going. And, I think it gets back to one of the things we were talking about earlier in our conversation of it's important to take care of yourself as a person, to make sure that you're getting enough sleep, that you're doing things to alleviate any kind of psychological stresses, that you're eating right, that you're keeping your social relationships in place as much and relying on them and calling on them as much as you can, perhaps via Zoom instead of in person. Those things are all really important to do, etc. So, and I guess the other thing I think about is, in terms of, despair versus hope, in the end, for myself, it's like, what other choice do I have? I kind of have to respond to the moment and have to be hopeful, because if I don't, then sort of all is lost. So I guess trying to keep a perspective on it all is it's hard, but it's important to try to do, and to rely on your colleagues and so forth. We're all in this together, and quite frankly, we're only going to succeed at addressing all of this by working together and accepting that we're going to have different points of view, and that's okay. We can agree to disagree at times. We all have different roles that we can play. Some of us are going to be a little more militant, and that's okay, because that creates the political space for the rest of us to do our work. This importance of an inside-outside strategy, that we're really all on the same team if we understand and accept that, work together as collegially and respectfully as we can. That's what's going to make the change happen.
Absolutely true. And for people who want to find out more about your organization and what they do, and maybe how they can support it, either financially or with their activism, how would they get in touch with you to do that?
Well, we have a website people can go to. It's metrohealthcare.net is our website. We have a Facebook page that we post things to regularly to kind of keep people up to speed. But rather than, just my own organization, we welcome any kind of engagement and financial support and so forth, as would any other organization like mine. But there are local organizations in your communities that are working on this stuff and have been. They may be specifically health focused, they may be multi-issue. I would say, the old maxim of, think globally, act locally, really find those organizations, find the folks around you, particularly since we're all having to kind of live local these days. So find those groups in your community that you can hook up with and get involved with them. I would really encourage folks to do that.
Excellent, excellent. All right. Thank you so much for joining me, Mark Hanna. It's been great talking to you today.
Great to hang out with you again.
So very interesting array of information. And Catherine, I liked how you have that some of these doctors are recommending things that can help to boost our immune system and help prevent illness, as well as like Mark is getting into the activism that's needed in order to improve the systems that we have, which is considering changes in policy and distribution of resources and all of that.
I was really surprised to see that there was this vast disparity in New York City from borough to borough. And I would imagine the same is true from state to state, where certain communities just don't have access to the same bed space or resources. And we know about the fact that, not everybody has health care or the kind, and now that people are unemployed, many more won't have that health care. And it was interesting that in this interview, Mark also talks about how important it is to, keep up one's own well-being as an activist. And I want to invite people to be able to visit, and they'll be able to see the whole interview on the WE website
Sure.
as it comes up. I just wanted to give that connection to people again. If you want to call about getting healthcare, is 646 NYC .care, CARE, and get information, or go to the website nycare.nyc. And there are public hospitals where you can get help in the Bronx, Brooklyn, Manhattan, Queens, or Staten Island.
Right, and there are probably similar things in other locations as well.
Mm-hmm. Well, I'm sure there are. I think most public health systems have some free hospitals. I can't say from state to state what it's like, or country to country what it's like. Unfortunately, in United States, we don't have universal health care or health care for all, so that people are pretty much left on their own, as you would find in other places in the world. So it's really important for us to be able to realize that this is something to work towards. And I would play more of the interview with Mark, but I wanted to be mindful of time.
Sure, and once these videos are up on the health page of the WE campaign, again, I'll say that link. It's 11daysofglobalunity.org/health. So once it's up there, people will be able to see these things. And also, I think there's, a little bit of streaming lag time as we were showing them now. So that people will be able to see them in their original form on that website. Do you want to bring in Paulette, and maybe we'll do a little roundtable to finish up?
Hi, Paulette.
Hello.
Well, thank you so much for hanging in there, Paulette. I thought we had lost you.
I was always here.
Well, that's great. I'm so glad that you came. And I think that a lot of bases were covered in terms of connecting the doctors to the community, in terms of connecting people to activism, as well as to steps that they can take for their own health. And I'm wondering how you would weave those concepts into the work that you're doing with community engagement.
Well, I think that it's, as what one of the doctors, or several of them said, I think being physically active is extremely important. I find normally the way I relax is in normal times is that I dance, but since I can't do that now, I find that instead I walk a lot. So not everyone may have that option, but if they do, it's a good thing if, let's say, you figure out a spot where a place where you can walk, you can measure the mileage on Google, and actually then make it part of your normal regimen. For me, there are a couple of places that I walk to in Harlem where the distance between my home and the destination is exactly 2.5 miles. So if I have the stamina, I can cover between 5 and 10 miles a week. And so these are small things that are very important. We still have our green markets on the street. We talk about nutrition, and it's although they may not be as plentiful as before, They still exist. And there are sources here in New York City, such as the Center for Food Policy at Hunter College, where you can go and they have a wonderful website where they by borough, they show you where you can actually access food, whether it's pantries, whether there are, or as they say, green markets. And all the also articles on food policy and food access disparities within New York City. So that's the Food Policy Center at Hunter. One thing that I tell people in normal times, usually I tell this to physicians actually. I've been asked several times to come and speak to incoming medical schools, incoming medical students. I tell them one way to get to know the community well, depending on the community and the culture, is to dance with them. And usually people sort of look up at me and wonder, what do I mean by that? I live in an area here in this borough that is heavily sort of from a Latino culture. And it's very rich in terms of music, rhythm, sort of the different arts. And what I found is, while trying to get rid of my shyness, I ended up falling into dance. And I realized that for physicians, for anyone who needs to know or wants to know their community beyond the boundaries of their office, actually stepping outside of your comfort zone and staying there is a very, very good way that you learn about the people that you're going to be serving, and they learn about you. And I tell people that roughly 70% of how we communicate with each other is nonverbal. And when you have to take a class with someone and then it's just you and them and you're complete strangers, you learn how to feel each other. It's energy. And doing that enough in as many venues as you can, you kind of get the sense of who the community is. You see how they socialize with each other, how they communicate with each other. And for people who are not from New York City or New York State, who may be coming from another state, who may not have exposure to these cultures, this could be a very good way to, as I say, a person can learn about themselves within that sort of milieu, while really feeling the community that they're serving.
Excellent. And that website at Hunter College is nycfoodpolicy.org. I just looked it up. It's nycfoodpolicy.org, Hunter College, New York City Food Policy Center. So that's a really good resource for people who want to connect with food. And I do feel that as we move forward, I'm really beginning to realize that it's not about this disease or that disease or the virus we're encountering and whether or not there's going to be another one coming down the pike. The idea is to withdraw from all of this chaos, withdraw from all of the anger, withdraw from all of the fear as much as possible, and begin to really focus on our own health based on our decisions, the food we eat, the nutrients we choose to take, making sure we're connecting to our healthcare providers, checking in on free resources if we don't have healthcare providers, and really paying attention to our relationships so that we can have those relationships, be it phone calls, be it Zoom calls, be it texting. We must stay in contact with the people we care about and the people that we love. And in this particular pandemic, I lost someone very, very close to me. And it was interesting that I probably hadn't been in touch with him for a long time until the pandemic. Our family started coming together. We started communicating and having phone calls and texting. and checking on each other. And so even though losing someone close was a shock, I'm grateful that there was this opportunity to reconnect before experiencing that loss. And I want to encourage people that part of the mental, emotional, and physical health are those three things. We can't ignore one and just focus on the other. We have to understand and we have to support each other and help each other to get through whatever challenges we may be faced with. And Rick, did you want to?
Yeah. So yeah, I think what you're saying there is really essential, Catherine. And one of the things that occurred to me as we were listening to the doctors and Mark Hannay and discuss it, it brings up this whole issue that We the World is involved with, and the We campaign, you know, creating a we-based society, because it's obvious that we have whole groups of people that are disproportionately affected by the COVID problem, and in fact, they're all, you know, it's the same vulnerable populations whenever there's a major crisis. If it's a hurricane, like you know, it could, or tornadoes, or the wildfires that are happening, and you know, we're not treating everyone equally in this society, and it's, you know, it's really essential. I think one of the lessons that's coming out of this pandemic, at least for some people, a major lesson is that we can no longer afford to treat people in such unequal ways, because, you know, if even one person in a community gets COVID-19, then the health and well-being of the entire community is at risk. And that way of thinking is really the essence of a we-based society. So it's not just from COVID-19, but if people are discriminated against, or you know, any different, you know, if people are treated differently, it affects the whole society. It's just more obvious now with the pandemic. So that's why this is for us, you know, making that cultural shift towards having a we-based society that prioritizes the common good is so essential now. Any thoughts?
Absolutely, and I agree with that. And you know, it's like as we are in the world, we also have to be with ourselves, and we have to also internalize that idea of making sure that we're okay, that we're doing the right things, that we are following this advice, that we're getting the sleep and the rest, that we're eating nutritious food, that we're consulting with practitioners that are going to help us shape our nutritional intake, or do the research and bring that nutritional intake into your life. And most importantly, understand that how our mind operates and how our emotions operate are going to interact with our body. So it's really important to find a space where you can relax and de-stress. For some people, it's walking. For some people, it's movement, yoga, qigong, or for some people, it's direct meditation. But we should all find ways to calm ourselves down, maybe put aside the social media for a little bit, breathe deeply. We can, you know, just put your hand on your body and connect to the heart as you breathe, and really give yourself the best opportunity to stay healthy, stay well, and be able to engage in the world. And together we can bring about all of these changes.
So I have an idea. How about I have a few announcements to make, and then after that, do you want to close us out with a brief Qigong oriented meditation?
Sure, that'd be great. Thank you.
Okay, so first of all, thank you, Catherine and Paulette, and of course all the other folks who were who we heard from, Mark Hannay, and the other doctors, Dr. Ken Redcross, Dr. Christine Horner, and Dr. Stephen Sinatra. Just to let people know, we're at day 5 of the 11 days, and we have many other interesting panels and all kinds of activities and things happening for the rest of the 11 days. So please check the schedule by going to 11daysofglobalunity.org. The 11 is a numeral, as I've said. And there you can see what's happening for our upcoming Telesummit panels, and you can watch previous panels also, like this one, whenever you want. And I also want to, of course, mention the first summit that we did to launch the 11 days this year, the Summit on the Future of Humanity, with Archbishop Desmond Tutu and Vandana Shiva and many others. And to watch that, you can go to We the World's Facebook page, which is facebook.com/theWeCampaign, or you can go to our YouTube page, which is youtube.com/WeTheWorld.org. And to learn more about We the World and the We Campaign, you can find out everything by going to we.net. Remember, this is creating the transformation we want to see in our society and the world is not a spectator sport. Collaboration is key. So if you go to we.net/partner, there you can sign up as an individual and join our We team, or you can sign up your organization. We.net/partner, all lowercase. So, Catherine, why don't you take us away with a brief meditation?
Okay, so I'm just going to move back a little bit and ask everybody to find a nice, comfortable posture in your chair. Allow your feet to rest on the floor. And then simply bring your awareness to the movement of your breath. And allow your inhaled breath to flow into your body with your awareness. And as you exhale, allow your awareness to follow the exhaled breath, so that your mind gently becomes engaged in the movement of your breath, inhaling with your awareness, and then gently exhaling with your awareness. And as you continue for a moment, you'll begin to realize that in the middle of those inhale and exhaled breath is a brief pause. So as you inhale, bring your awareness into that pause where there's no breath. And then exhale slowly. And inhale deeply, expanding your body with the breath, and then sink into the pause of no breath. And then exhale slowly, releasing your breath, allowing your awareness to follow with your breath. Each time a little slower. Inhale deeply. Feel the pause. And then exhale, releasing the breath. And let's take another deep breath, inhaling deeply. And when your awareness reaches the pause between your breaths, just let the breath go, allowing it to float away. And keeping your awareness in the center of your chest, allowing yourself to feel into the energy of the middle of the chest, the heart center, and the middle dantian. Bring your inner awareness, your hearing, and listen for the silent and soft voice of your heart. And then allow your awareness to sink deeper into your body. In the lower abdomen, we have a field, an elixir field called the dantian. And it's like as if you were looking across the ocean at the sun, coming close to the sunset, beautiful, radiant. And we see that within ourselves, our own energy, and bring the awareness into the vitality and life force. And we can guide that energy of life force to flow down through our legs and radiate from the feet into the earth. And it becomes like our roots within the earth. And the earth returns to you through your roots, its nourishing energy, which rises through your legs, through your hips and torso, into your shoulders and arms, rising into the brain and face. And the earth flows through you and rises to the Baihui, into the cosmos. And when the cosmos recognizes your presence, it returns to you its gentleness, its peace and connection. And that cosmic energy rains through your body gently like a dew, softly washing away the stress and the debris, washing the brain and down into the neck and shoulders, and down through your arms to your fingertips, washing through the chest, cleansing the organs of your body, flowing down to the abdomen and down to your legs, and meeting the earth underneath you so that we can stand with our feet in the earth, our head in the cosmos, relaxed and natural, in harmony with heaven and earth. Let's take 3 deep breaths, and with each breath, exhale, sending a wave of relaxation through the whole body. Inhaling deeply and exhaling slowly. Take another breath, inhaling deeply and exhaling slowly. One more breath, inhaling deeply and exhaling slowly. We can gently open our eyes, come back into our awareness, and then take that time to savor. You could do it again throughout the day and learn many, many more practices that can help you to melt away the stress and rebuild your vitality and energy. So thank you for that. And thank you, Rick, for this program.
Thank you, Catherine. That was beautiful. And it's great to see you and Paulette and hear all this wonderful information. So as we go out, I'll remind people that what we've done today is kind of like our motto for We the World: inspire, inform, and involve. 3 I's that make a we. So we can go from a me society to a we society. So,
Thank you.
Thank you.
Thank you to everyone. My heart goes out. Thank you very much, Paulette, for joining us today. And thank you, Rick, for all the work you've done in making this possible.
Okay.
I also want to thank Mark Hannay for making the time this week to be part of this.
Exactly. And you were co-hosting for years with him with Health Action.
Yes,
the show.
10 years it seems, maybe more. Yes, right. On WBAI in New York. And people can still find me there for Heart of Mind.
Right, WBAI.org.
Right.
Okay, bye-bye, everyone.
Thank you.
Thank you. Bye-bye now.
Bye-bye.